The next bill that we have on the agenda is House File 5200. I will move that on behalf of Representative Gillard, the House File 5200 to be laid over. And I see you've got A4 amendment. Did you want to proceed with the A4 amendment, Representative Gill?
Thank you, Chair and members. The DE amendment adds kind of a significant component to it. Is there a way that we could talk about the bill maybe as it is first before we amend it?
Yes, please proceed.
Okay. Good afternoon, Chair and members. I'm not totally sure what day of the week it is, right? But happy whatever day it is, and glad that we're all here. This bill really comes to the work that we've been doing around preventing and ending homelessness in Minnesota. In 2021, we actually had a Preventing Homelessness Committee where we had a lot of discussions about what do we need to do in the state to really end homelessness, and there's so many components to that. That's one thing that we learned, I think, and bipartisanly really agreed on. And what we did in the last 2 years is make a significant investment in our shelter, emergency shelter capacity, getting people off of the streets. But there's a long-term continuum that happens here. I like to think of it as this braided approach, that we braid all of these things together for a long-term strength to actually do the work that we're trying to do. And so what this bill does is it's creating a working group, taking a geographic spread, because I do think that that's important, that we try to have geographic voices at the table when we do working groups on ways to simplify supportive housing. And the nice thing about supportive housing is it's a long-term solution and evidence-based, proven to have good outcomes. What it does is it weaves together rental assistance, but also the supportive tools that individuals need for the long-term support to actually get out of homelessness, dig out of poverty, and become successful individuals in Minnesota. And so with that, Chair, I guess if we could move to testifiers to talk about this portion of the bill, I think that may be best.
Thank you so much. I think we have testifiers who have signed up. The first person is Sean. Pierre Sean. Welcome to the committee. Please introduce yourself for the record and proceed.
Okay. Good afternoon, Mr. Chair and the chair committees. My name is Pierre Shong. I am the executive director of Handy Help. We provide we have over 100 employees and over 1,000 clients. Our 50-60% of our clients are from the culturally specific, and we have about over 60% of my staff are culturally specific, meaning that English is not their first language. Over the last 10 years, we've been providing support in various ways to help people maintain independent housing in the community. And currently, one of the challenges that we have has been, why this is so important, is that when you have employees who don't speak English, or English is not the language, and you have clients who don't speak English, or that's not their primary language, I think that English in itself is pretty complicated, along with the acronyms and all of that stuff. To add in all the complexity, we have all these forms, and then we have multiple steps that we have to have someone who's homeless in an encampment. We're trying to get them transportation, getting them into the coordinated entry, just to get this assessment. That's very lengthy. After all these lengthy assessments, the person thought they're ready for housing or for the support, but they're not. Because from there, they take the assessment. The person then has to go on to work with a designated case manager who has to verify every step if they're homeless and every information. And this takes it takes weeks to a month before they can even get services. Multiple forms, and we also asked, the forms are very complex, and a lot of forms may be asking the same questions, but different forms is required. And we put the clients through all this traumatic experience, especially if they have mental health. A lot of time when they're in encampments or homeless, their mental health may not be well taken care of. Their days, they don't know their days. Diet, nutrition, they haven't had their health or physical for a while. So with this, we have clients who are trying to tell their traumatic experience all the time, and every questions they have to talk about it, and they thought they're done, they have to ask more. Same questions, but different forms. With all of this, I believe that as a providers, the simplicity and simplifying all these forms would be extremely helpful, not just to not have a client have to go through this traumatic experience and having to talk about their experience all the time. But it goes to one place to another with transportation being difficult so that we can get services on board. As a provider, I think it's really difficult to get clients to get services because we lose them after one appointment or two, because having to go all of this, we can't even get them into getting services. They're lost already with the assessment, or trying to get to assessment is extremely difficult. And I think that the simplicity of the forms and reducing duplication would be extremely helpful to get clients to benefit from the services. We talk about equity, and I think that because all clients come from a different place, we have to look at it different ways to get client enrolled. In addition to that, on a worker standpoint, as a cultural specific provider, getting my worker to learn to do English, they know the work, but getting them to do all these forms over and over, it takes such a long time for them to do this form with the clients. And then nothing comes out of it because the clients have already lost trust with the government, with the providers, and they still don't get services. By the time they get a phone call from the provider or whoever, they have already lost they went through 3 phone numbers already. And this is so hard. And the training behind the scene to get a culturally specific worker to get out there, that's a lot of work. As a clinical supervisor, as a supervisor behind the scene who's trying to proofread, I'm not an English major, but in this job, I learned to be, because if they don't do this form like the housing focus plan correctly, they may get rejected. 30 days with the forms in DHS, coming back and say it's not good enough. I think that there's a lot of forms that have not been updated with DHS, and I know we mean well. We want to work together so that the form reflects the real time, because right now, getting a PSN, it's extremely difficult. Doctors are exhausted, professionals they don't have capacity. So when our workers trying to send this PSN for someone to sign, it takes forever, and it sits forever, and they don't get that. On top of just getting certification like a PSN or medical opinion, there are 3 different ways to verify disabilities. You may get a mental health professional to sign off, but then they can't get a medical doctor to sign on the medical opinion form. And all of this, again, it's a way to discriminate people who do not have to get on system. And I think that's why we have so many clients who are in encampment, because getting services is extremely hard. So with that, I truly support something that simplifies things, and I know that we can do this, and I think that as a system, I think we can find a solution to help those who maybe already don't trust the system, don't trust the government, that we can make this system so much easier so that we can really truly talk about equity, and that we can walk equity and not just talk about it. Thank you.
Thank you so much for your testimony. The next person is Lindsay Hoffer. If you can come to the testify table, please introduce yourself for the record and proceed with your testimony.
Chair Knorr, Vice Chair Bonner, and committee members, my name is Lindsay Hofer. I am the Program Director at the Minnesota Assistance Council for Veterans, MACV. We are a statewide 501c3 nonprofit with the mission to end veteran homelessness in Minnesota. We pursue our mission in partnership with local, state, and federal veteran-focused organizations who support our work in housing, housing subsidies, program development, holistic case management, and thought leadership, which has formed many of these critical interventions. I will be part of the work group this bill aims to establish. While MACV and our partners have made incredible progress towards our goal of ending veteran homelessness, we've also seen how the administrative complexities of the social service system can delay or prevent our veterans from accessing housing. To mitigate this gap, MACV launched a documentation specialist program in August of 2023. This program offers transportation, coordination, and technical assistance to veterans needing vital documents for services, employment, and housing. While this program has already proved successful in reducing the time a veteran is experiencing homelessness, our one FTE is not enough to solve this broad issue that affects all Minnesota veterans experiencing homelessness. We believe establishing this work group will be a great step forward in easing the bureaucratic burdens of our unhoused neighbors, including the 248 veterans experiencing homelessness in our state today. Thank you for your support of this initiative, and Representative Keeler, thank you for authoring this bill.
Thank you so much for your testimony. Do we have anyone in the public who wants to testify on this bill? Seeing none, back to you, Representative Gill. Did you want to move the amendment now?
Thanks, Chair. Could we have member discussion? Again, I feel like the amendment is doing a lot of things that I don't want to take away from having the conversation about creating the workforce and the importance of that. If there's any member discussion, I think I want to be able to say that this is absolutely a work in progress. You know, I'm a bill author that's still looking at amendments and what the agency sent over and still trying to work to make this right. So it is a work in progress, but absolutely, if we could have that conversation, I think that would be great in this moment.
Lead New Brindley.
Thank you, Mr. Chair. And first, Representative Keeler, I want to thank you for reaching out to me outside of committee. And, you know, as I said, she approached me and said, I want to talk to you about making you hate this less. And I said, I actually don't hate it. So it was a good start. It was a good start. And in fact, you know, to the first testifier, I would say I really appreciate the things he had to say. And, you know, one of the things we talked about, I think, extensively in that committee is how complicated it is. These lengthy assessments, it's time-consuming case management. And I thought, boy, wouldn't it be interesting if we as legislators could figure out how to help government function in a way that it actually serves people, and we don't have to pay probably billions of dollars in case management. If we actually simplified government so that it actually just worked for people. That would be remarkable. And I think that's your goal. I think that's your goal, is to simplify this process so that it actually works for people. And so just right off the bat, I want to say I actually really appreciate that goal for this bill. And like I said, the amount of money we spend in case management, just helping people navigate a complicated system, is sort of obscene. And so if we can simplify that and try to start minimizing those costs so that those dollars can actually go towards helping people in more tangible ways, I think that's a benefit. I think that's the benefit to certainly the folks who need the help. It's a benefit to the state, and it's a benefit to taxpayers. I think that is win-win-win. So I really appreciate that. And I also appreciate the fact that this is a work in progress. I think it is interesting that in the amendment, which we will discuss, that one of the nonprofits is switched out for the Minnesota Assistance Council for Veterans, which actually I think it's important to have MACV involved in the conversation, because of course veterans are a unique group in that there are a lot of other resources available to veterans that have really helped to largely solve the homelessness problem among veterans. So it makes sense to have that voice at the table. I think that is also really important. So that's, whether the switch is good or not, I'm not going to comment on that. But to have veterans groups who understand this issue at the table, I think is really important. You know, some things that we talked about that I do think are important to think through is, does it make sense in this language to specifically delineate exactly which nonprofit organizations are going to have a seat at the table? I'm not sure that that's the best way to do this. I also think that sometimes in an effort to make things appear nonpartisan, we explicitly make them partisan, and I appreciate your concession on this point as well. You know, this bill language would include a member appointed by the Speaker of the House and a member appointed by the Senate Majority Leader, which means that it's entirely possible, not necessarily true, but entirely possible, that it would exclusively include one party. And I think that we get better results, and I know that you believe this, when we have different voices at the table and different ways of viewing things, and we're asking different questions. So I think things like that are important as well. Obviously, this is the kind of thing that, you know, once again, we spent $500 million on homelessness last year, in addition to all of the money that was already in homelessness. And this is the kind of thing that I wish we had included in that, because now anything we're spending is adding to our deficit problem. So, I mean, we should look at these numbers and see if they make sense. But we are adding to that problem. We need a broader coalition. The other piece I would ask you to consider is, you know, I've authored legislation for the last, I think, 4 years now, modeled after our workforce legislation, so that we can start to get a handle on, this is such a complex area. And, you know, I mean, we were just kind of offline saying, well, how much money did we spend last year? Well, it's complicated because it's all very interconnected, right? In lots of different areas. And so we need to start getting a handle on where the money is going, what populations are being served, you know, what aspect of homelessness are they addressing, and what are their success rates? Because we need to start to get a handle on, you know, if there are two organizations who are serving essentially the same population, offering the same services, but one has a really good success rate and one is meh, well, then we need to amplify organizations that are successful. So we need to start gathering that data and understanding what is happening in this space now. Because the one thing I think we all agreed on in that committee was that, boy, we don't have a handle on this. And we don't know exactly how much money is in homelessness, where it's going, what populations are being served. And so I hope that we will consider some reporting requirements. And like I said, I have legislation modeled after our workforce. We require this of nonprofits who receive workforce funding. We require them to report who they're serving, you know, what are their outcomes, 2 years, 4 years, whatever those specific numbers are. But we require that so that we can know what programs should we be amplifying and what should we maybe consider cutting loose because they're not the best use of taxpayer dollars. So I apologize for going on. I actually appreciate the intent of this and just hope that we can consider these other things as this is a work in progress.
Any other member discussion?
Oh, wait, can I reply to that? She just gave me a whole lot, and I don't even get to say anything. I got notes to say back.
Your notes are well taken.
Thank you, Chair and Representative.
Representative Kyo.
I do want to highlight the fact that we do really need to look at the forms, you know, like really having a review on that and what state and federal level and how we can reduce that, because I think we all agree getting into the work is actually so much more important than the paperwork part of it. Being efficient and effective is my goal. Coming out of poverty, I feel like I always try to get my pennies to stretch as far as possible with good intention, and that's really what the goal of this work is. I do, if you could see all my colored notes on the things, some of the things that you brought up, you know, when we heard in Children and Family, I think it was earlier this week, another committee language was written like that it's one member from the House, one member from the Senate, and I even brought it up then, and I think Zeleznikar was there, that does not sit ethically well with me, because I do think it brings value to the table when our different philosophies of solution can come together and really work at a long-term goal. So taking that into consideration, and also the named piece of it, I think we have maybe some approaches we can look at from there. Also understanding that we all have players that we really believe are doing a great job in this area, and bringing them together actually gives us the best outcome for the future in Minnesota. So those points are all very well taken. And I think you've given me some other points that I'll utilize to lead into the other part of my amendment. Chair, if there's any other members that want to talk about the first part of the bill.
I see any other member on the list. So with that, I think we should proceed to the A4 amendment.
Okay.
I move A4 amendment on behalf of Representative Keller. So please, if you can give us a brief statement on that, and we will go to member discussion.
Thank you, Chair and members. So the amendment here, part of what the amendment does is it does take into consideration some of the things we heard from stakeholders and the testifiers today by adding language to include coordinated entry as one of the things this workforce would, or this working group would actually look into. From what it said, maybe even the forms would be another thing to add. But the piece around this that probably has more to discuss is the fact that we're actually adding, we're adding a new department into DHS, and what this does, and Chair Knorr, if you want to help me kind of walk through this, but it's creating a lane for a lot of the agency, or a lot of the work that is slated to move over to DCYF, which is the Department of Children, Youth, and Family. A lot of the homelessness work is moving over to that department as it's slated today. There's a group of us who have deeply worked on preventing homelessness, stemming back from the Preventing Homelessness Committee, that really feel strongly that a lot of the homelessness work, back to some of the things, veterans, families with adults, and families or individuals that don't have dependents, that if we move our homelessness efforts to DCYF, there's a concern that those efforts would only be focused on children, youth, and family, and not the entire person or individuals of Minnesota. We also know that the groups and the programs that are staying within DHS align with our homelessness efforts as well. And so it's a fix that we use this bill as the vehicle to have that conversation in an honest, good way, to try to make sure that all of the money we did put into play around homelessness doesn't drop through cracks of moving into a brand new agency, and it's a way that we can continue to stay focused. I do like the idea of some sort of intentional reporting back, and I think adding some sort of department that would oversee homelessness and housing supports only, we could do more reporting, including the where, the who, the why, the uniqueness, and what does success look like, and how do we meet that level of success, and what are our success goals, SWOT analysis, even if that. So I take that feedback really well and would be willing to have more conversations around that. But with that, Mr. Chair, that is the amendment as it is.
Thank you. A member discussion. I see Chair Fisher.
Thank you, Chair Knorr, and thank you, Representative Keeler, for the amount of work you've been doing and leading on these efforts. Very much appreciate the way you engage people across the process. I'm very strongly supportive of what we're looking at here from a variety of areas. You know, I've worked in the homeless youth world since 2007, and so I've seen a lot of things that have come and gone. You know, your first part of the bill is great on simplifying the process out there. What really helps, I see, in this area here is, you know, bringing in the different groups that you didn't have mentioned in your first one, particularly the coordinated entry part is, I know there's some good things there, but, you know, there's some things, particularly from the federal level, that just drives everybody batty, and it's good to make sure that they're part of the process. One of the things, too, is very important is that seeing that we're wrapping the homeless services and keeping them within this area. And the reason I say that is so often people dealing with homeless issues are dealing with many other issues at the same time that are all taken care of in the human services area. We're taking a look at addiction. We're taking a look at the mental health areas. So often we've got people who need support and assistance that are also looking at Medicaid, all these other services that are in. If we're looking at the extension of the 1115 waiver that we've talked about in this committee, once again, that's getting to people who are precariously housed. I just see us having a lot of sense wrapping these duties all together in one area. And what is really good is that we're putting this into statute. Right now, you know, the council is out there that the governor had originally established a number of years ago. And I think that as a state, if we feel it's very important, we should be putting this into statute so that it doesn't rely on the whim of a governor at any one period of time, and that we put it in and give it the resources to make sure that we're focusing in and wrapping in all the other parties that need to be part of it. I think that is where we start really breaking it down. We've seen that work well with the in the veterans issue, where they brought people together and worked really well. We've made great progresses by looping in the other services when we're looking at SUD, how people discharge from there, mental health. It just makes sense to further refine those connections by bringing it all together into one office. So thank you for your work. I know you'll continue working on this.
Any other member discussion? Lead New Brinley.
Thank you, Mr. Chair. And thank you, Representative Fisher, for your comments as well. And Representative Keeler. And actually, it is interesting, and I think it is good to add the coordinated entry piece. I mean, I can remember in committee hearing just a strange number of folks coming out of prisons in Clay County. Like, just some really random, odd numbers that really do need to be part of that conversation. I think that's very interesting. I don't know why that sticks in my head from years ago. I mean, it will come as no surprise to anybody that I would have a pretty significant concern, particularly at this late hour. I think I completely understand the need to figure out jurisdiction here. Especially with the new agency to figure out jurisdiction of where this will be held, and I think that's legitimate, and that should be figured out. I would hope that some of that could be done more amicably behind the scenes, rather than requiring a new office and new assistant commissioner. I certainly, this is a big deal to create a new office and to add an assistant commissioner and additional staff, and we all know that this is going to grow. This is a really significant thing we're doing here, and I'm a little concerned about the late hour of this coming forward. And I mean, obviously, I presumably there will be a fiscal note on this, but this is going to have pretty significant costs moving forward that won't go away, and that we're going to have to figure out how to pay for in deficit years. So that would be a pretty big red flag for us. Thank you, Mr. Chair.
Representative Gill.
Yeah, thank you, Chair. Thank you, Representative New Brindley. So I don't know if you can remember Dr. Foldis when he did that economic statement to us when we were in preventing homelessness. Do you remember he had like over 1,000 youth that he follows for a year and saw that only 6% of them needed to become like fully out of homelessness to become like a functioning Minnesotan, right, to give back. And so it showed us that when we invest in homelessness, it actually has a really powerful return on investment long term. And I'll tell you, I can't sit here and say I'm a champion for homelessness and not try to do everything, even if it's at the last minute. There is genuine concern in my mind, and I think in others, and it's just a shot that I have to actually follow through with the commitment that we will do absolutely everything we can to make homelessness a priority and not allow it to just fall in all of these silos and all the spaces that we know homelessness reaches across the state. And so, again, absolutely a work in progress, not great on timing, but also more concerns have come up in the last couple weeks as we've seen the governor's package come out and show where kind of some of that money follows. And we need to make sure that we support adults without children, seniors, veterans, all of Minnesota when it comes to it. So honestly, happy to have more conversations around it.
Any follow-up?
Thank you, Mr. Chair. Thank you, Representative Keeler, for bringing this proposal forward. I know you and I have had numerous conversations about this and about some of the changes that we are going to be seeing in the shift from DHS and MDE to DCYF. I think this is a conversation worth having to ensure that there are people whose day-to-day work is solidified and not, again, just focusing on folks who happen to have children, who happen to be young, as we all are at some point in our life. But then when we reach that point where then we are adults and we may not have families of our own, and we may not have some of the additional dependents and things that. So I think when we look at the interplay between those two, I think it might be worth discussing including a representative from DCYF in either in the working group potentially, just so that correspondence and knowing that in addition to focusing on all Minnesotans all across the state and meeting where they are, how that does interplay with the work that the new department will be doing. So I really appreciate your time and effort that you put into this.
Any response, Representative Gill?
Yep, thanks, Chair. Thank you, Representative Katiza-Watun. I think that's a good point. The part that we went without naming it is that we have the interagency, and in that role, any new commissioner is already appointed to the interagency on homelessness, so we thought that was already including DCYF, and in the DCYF language for commissioner, they're required to join that as well. So I think in our mind, we thought that was kind of covering that area, but again, the more people we need to be engaged and crossing paths to make sure that the silo work that we do right now doesn't allow cracks for individuals to fall through.
Seeing no one else, I just wanted to note this. This has been a major discussion when we talk about homelessness and housing support. Currently, DHS is doing this work. It's not a significant shift. It's making sure that the alignment, the streamlining, and ensuring that the work that is already happening within the department continues to happen within DHS. We know that housing support will stay there. We know that the general assistant, MSA, we're talking about individual with substance use disorder. We're talking about individual with mental health. We're talking about individuals who are disabled. We're talking about seniors. We're talking about a huge population here that is currently being served under Department of Human Services. So this is a clear direction that the work is already being done, and this is how we wanted to make sure that the work continues. Whether it's the housing support or homelessness, needs to stay within DHS rather than any other entity. So this is more giving the direction to the administration that it has to stay there. I don't know if you wanted to have a follow-up, Lead New Brimley.
Thank you, Mr. Chair. I do want to follow up on that because, I mean, there were a lot of things very clearly defined when the new department was established, and we can continue to define that. And we can define that without creating an office and significant future expenses on top of that. Thank you, Mr. Chair.
Your closing remarks, Representative Keeler.
Thank you, Chair and members, and honestly, thanks to everyone around the entire table and in the community for joining me in this conversation to really think broadly about, what does homelessness look like in 20 years in Minnesota? I think often we make decisions as today. I'm really thinking about generations that maybe we don't even know yet. And I do just want to end on one of the most impactful memories I had in my first year here. We were in the pandemic and we were all online in preventing homelessness. And we had a gentleman join us to tell his story. And by our next committee hearing, he had passed away. And there was a moment in time that we're just not doing enough. And I asked myself a lot, and when we set things up, how would the system right now support an individual man with no dependencies who was 70 years old in the state? And I think that's the story that resonates to me, to make sure that those are the people that we just continue to care about in this work and that we do. And we don't get it right all the time, but this is just a genuine effort to try to understand that moving forward. So thank you all for your time and your efforts to end homelessness.
Thank you so much. With that, I just wanted to ask all those in favor of A for amendment, please say aye. Aye. Opposed?
No.
No.
The amendment prevails. With that, I wanted to renew Representative Keeler's motion that House File 5200 as amended to be laid over. So the bill is laid over.